What's up, everybody? My name is Matt, and if you're new to my channel, I do a lot of movement and self-massage stuff because I'm a yoga teacher and a licensed massage therapist. I teach a class here in St. Louis at Joy of Yoga at noon every Sunday. It's deep stretch and massage therapy balls, kind of like yin flavored more than anything else. So sometimes you don't even get up off the floor. But today I want to share with you guys an exercise I did in my class today, where we're going to roll out the piriformis. And the piriformis muscle is at the base of your sacrum. Your sacrum is this little bony part right here, right just below your waistline, and you come out a little bit to each side. You'll start to feel some soft tissue. That is your piriformis. It is active when you are, kind of lift your leg and move your leg out to the side. It's a hip abductor, and it gets stretched when you're in pigeon. It's also one of these things that gets in when you have sciatic pain. That's one of the muscles that is a culprit in that, along with the sciatic nerve and the some of the associated glute muscles back in there. But we're going to take this is a yoga tune-up ball. You can use a tennis ball, a racquetball, or a lacrosse ball, anything that works for you. But we're going to find a piece of wall, and the therapy ball is going to come on. I'm going to start on my right side piriformis and just kind of lean back into the wall here. And you may feel some sensation in the glute area, maybe running down into the front of the thigh, maybe into the back of the leg, into the hamstring area. Again, that's all connected in there with nerves and stuff like that. We're going to breathe. You can close the eyes or not. It's up to you. And then we're going to bring a little bit of movement here in. So we're going to strip this muscle. So you're just going to turn your hips to the left. So you're almost kind of facing to the side, coming almost, that ball is going to track to the outer part of your thigh, the back outer part of your thigh. And then we're going to come back to the center to where we started. And then we'll go out again. And again, you can press into the ball as much as you like or as little, depending on how much sensation you like to use. And then we'll come back to the center. If there's too much, you can always move it a little bit up or a little bit down for you. We'll do this about 5 times. And as you're doing this, you may feel some little like roadblocks, bumps in the road. Those are trigger points. And then if you find a trigger point that you want to try and tease out here, I'm gonna find that, maybe breathe, press into it a little bit more. You can always smile, maybe bounce the knees a little bit. And then we'll ease away from the wall and kind of, you can either stand and kind of feel the difference between the hips, or if you want to make a little bit of figure 8 motion here with the hips or hip circles, just to kind of get the blood flowing a little bit more, get some movement going. And then we'll do the other side. So again, that therapy ball comes outside or to the side of your sacrum. And then we'll lean against the wall. Take a couple of breaths here. And then that turning to the right as your therapy ball slides to the left. Do that about 5 or so times. It's kind of like a salsa dancing move. And then finding a spot where it feels comfortable to sort of pause, maybe press into, breathe, and bounce the knees just a little bit. And then can ease away from that. And again, you can stand and just feel, or you can kind of move the hips a little bit and kind of get a little bit more blood flow. After we massage the tissues, we can bring a little movement to the tissues. So it's a simple, way to sort of alleviate or address some hip pain or maybe sciatic pain if you have that. Um, thank you guys for watching. Like or maybe subscribe, and yeah, hopefully I'll have something for you guys soon.